It's a beautiful summer day, and I'm stuck in a flat in ill health with multiple broken teeth in my mouth that are all rotting and festering into my gum line from where this Nazi dentist at the Headlands, Kettering, Northamptonshire, Nazi dentist called Dr. S.S. Tandy, drilled all my teeth out and placed disilicate ion lithium dental crowns onto my molars so he could torture me, and they've left multiple teeth all broken in my mouth. But the worst aspect of this is age 30, they sent me to Kettering General Hospital under the pretext of performing an MRI scan of my lower back. And I didn't know what an arthrogram was until I got there. And then the next thing I know, they put me in a gown with sedatives and then strategically embedded a needle into my groin triangle upper thigh pelvis. That was May 13th of 2008, just over 10 years ago. So for 10 years, the entirety of my 30s, I've been kind of forced to hobble around in agonising pain with this clinically disfigured leg that they've dropped me onto, with the needle embedded strategically in the groin triangle upper thigh pelvis. It's slowly killing me. It's excruciating discomfort, torture. I think a lot of this might have to do with the fact that my mother had association to these two bikers from a biker group when she was a teenager in West London, and the two of them were involved in an armed robbery involving the shooting of a police officer called PC Phillipolds, who was shot in the groin. PC Phillipolds was shot in the groin, and not long after he was shot, my mother was moved from West London to East London, about 40 miles away from Hayes, Middlesex, to Havering at Bower. And then in 1986, PC Phillipolds committed suicide. This is what they reckon. And then ever since 1986, I've had nothing other than problems off of the police and the NHS, as though they're getting at me to get at my mother because of her association to this biker outfit when she was a teenager, who were involved in the bungled armed robbery that tragically resulted in PC Phillipolds being shot in the groin. They've put this needle into my groin triangle age 30 at Kettering General Hospital. Then they've sent me to Northampton General a year later. The consultant there's called Dr. Jason Old, orthopaedic consultant at Northampton General. The police were hanging around his clinic laughing at me, and he covered up the strategic embedding of the arthrogram pin into my groin triangle when they disfigured my leg. He wouldn't x-ray, wouldn't CT scan. Then they had me sent over to a surgeon called Damien Griffin in Coventry, and he was supposed to be performing some type of surgery, but he wouldn't explain to me what he was planning to do. Plus, he sent me away from his clinic without performing any surgery. So basically, cut a long story short, they've got me at Kettering General Hospital under the pretext of this arthrogram procedure. I placed my trust in them, thinking they're going to be looking at my lower back. And then when I've got there, they've strategically embedded the needle. A multitude of needles have been used and placed into my groin triangle for the administration of these differing drugs, anesthesia drugs, a paramagnetic contrast agent for the scan and other drugs. But I think it was just a front. The pretext was they got me to the hospital under the pretext of an arthrogram of my right hip, lower back, and then when I've got there, they've told me they've needed to administer the drugs into my groin triangle, pelvis, and then they've either broken one of the needles, left one of the needles strategically on purpose intact, or the surgical pin, which looked very similar to the needles. On the trolley, she had surgical pins that have beveled ends that look very similar to needles. In the radiology anesthesia department at KGH. So she pulled out this trolley with all of these pins and needles on it and started embedding them into my groin, dropped me onto the anaesthetised limb post-embedding, twisted and disfiguring the leg under the influence of these muscle relaxants. Once the muscle relaxants wear off, the legs kept disfigured and pinned in that clinically disfigured position. Now, the needle that they've left embedded in my groin has been left there for so long that it's potentially fragmenting and it's potentially gone into a state of oxidation and it's breaking up. It's excruciating discomfort. Plus, they've put me into a tunable magnetron not long after, which would have heated the needle up after insertion into the groin triangle. So it feels like it's burning and stabbing and jabbing and causing the muscles to no longer contract, and it makes the leg feel as though it's disfigured and dislocated, when it's not. It's just this small 3 to 5 centimetre long piece shard of metal that has been strategically left embedded in the top of my thigh groin triangle. This is one of the first few YouTube videos that I'm making, that I'm about to place up onto the internet. because everything that I've posted to live stream or any other social networking media over the years seems to be blocked. So I'm going to see if I have any more joy with placing some YouTube videos over the course of the next couple of weeks. Yeah, I'll post this now and see what happens over the course of the next few days.